I'm going to tell you about a dog who was labeled anxious, destructive, and impossible to leave alone. But none of that was the real problem. His behavior was a medical signal, and most everyone missed it. His name is Ghost. Ghost is a 6-year-old golden retriever that had the softest face. And when he walked into my exam room, he looked like the easiest dog I'd see all day. His body was relaxed, his eyes were soft, he leaned into his owners, and he just wagged slowly, like he was trying to reassure all of us that everything was fine. And then his owners started talking. At home, Ghost could not be left alone. He destroyed rugs and ate them. If he was crated, he panicked until the bottom of his crate was completely soaked with saliva and his nose was rubbed raw and bleeding. He would pace, he would pant, he completely unraveled. They had tried medications for separation anxiety. One of them didn't help at all, and another made things dramatically worse. Everyone was exhausted. Then there was the water. Every time they filled his water bowl, he drank it dry, sometimes tipped it over, sometimes more than once. It felt intentional, attention sinking. Just one more behavior they could not manage. What made me pause was this. They told me Ghost was never like this when people were around. This calm dog in front of me that only existed when he wasn't alone. That contrast mattered. I see this same pattern in birds. Birds come in for feather picking. The story usually starts with boredom or stress. The bird is just being bad. The feathers are self-inflicted. But then we slow down and we look a little bit deeper. And sometimes we find hormonal disease, nutritional problems, chronic pain, and reproductive issues. The feather picking isn't misbehavior. It's communication. Cats do this too. Excessive vocalization, urinating out of the litter box, and sudden aggression. These behaviors aren't often framed as attitude problems, like my cat is terrible and they're just being, unbelievable. But one of the things I've also noticed is that in older cats that suddenly start vocalizing at night, especially when they never did before, they have a high likelihood of something called hyperthyroidism, where their thyroid gets overactive. Again, it's not misbehavior, it's communication. Across species, the pattern repeats. Behavior changes first. Diagnosis comes later, if we're willing to listen. This is why acting out deserves investigation. Behavior is communication. And when we label behavior without investigating it, we risk missing the biology driving it. Labeling behavior can delay the real diagnosis. Getting back to Ghost's case, the anxiety, the destructiveness, the thirst, the ravenous appetite weren't separate problems. They were all connected. Ghost's physical exam was completely normal. Heart and lungs sounded great. His abdomen felt normal. The lymph nodes were totally normal. On the surface, there was nothing to explain the chaos at home. But his blood work told a different story. His liver enzymes were elevated. This was something new for Ghost. And 2 weeks later, we repeated it, and they were even higher. When his owners measured his water intake, it was far beyond the normal limits. We put this together with his escalating anxiety, his hunger. Those details all pointed us towards a disease called Cushing's. Cushing's is a condition where the adrenal glands produce too much stress hormone. The diagnosis was confirmed with a blood test. Ghost's body was flooded with cortisol. His nervous system was stuck in overdrive, and he wasn't choosing to panic when he was left alone. His physiology made being calm absolutely impossible. When behavior is dismissed as training or failure or stubbornness, we often escalate management instead of investigation. Stronger medications, I tried that with Ghost. Tighter confinement, more frustration. Meanwhile, the disease continues to progress. Cases like Ghost have changed how I listen. When an owner tells me their pet is annoying, dramatic, or doing something on purpose, I don't correct them, but I do translate it. I ask when it started. What else has changed? Appetite, thirst, sleep, stress tolerance? I pay close attention to behaviors that don't fit the personality being described. A normally easygoing dog who suddenly can't cope. A quiet cat who starts yelling. A social bird who suddenly turns inward. Behavioral complaints aren't distractions from the real problem. They are medical data. Your pet isn't being difficult to make your life harder. They don't have language for nausea or hormone shifts or internal pressures. They have behavior. That's what they use. When you tell your veterinarian about the things that are driving you crazy, you're not failing your pet. You're helping us help them. Those details may be the missing piece that we need. Sometimes the most disruptive behaviors are the body asking for help in the only way it can. And if we pause before labeling, if we stay curious just a little bit longer, we may finally hear what the behavior has been trying to say all along.